Poiesis Medical has developed the innovative Duette dual balloon urinary drainage system to reduce the complications associated with catheterization, most notoriously bladder infections, but also bladder spasms, bladder blockage, and bleeding. Following years of clinical research, we can demonstrate how the Duette dual balloon provides protection from damage caused by the traditional catheter through a superior design. Catheters were first introduced in the 1930s and have had few modifications. Catheterization is a frequent and necessary procedure. Conventional catheters cause bladder wall trauma once the catheter is in place and begins to drain. The bladder collapses onto the offending catheter tip. Subsequently, the bladder wall lining, mucosa, is aspirated into the drainage eyes, pinching the bladder and causing further damage. Drainage is temporarily blocked until the bladder becomes sufficiently distended to free it. The end result is disruption of the mucosal and epithelial linings of the bladder, polypoid cystitis, and in chronic cases, an increased risk of cancer. Rarely, complete perforation of the bladder results. When the catheter is blocked, painful bladder spasms and subsequent leakage occur, leading to patient discomfort. Sadly, this cycle continues, creating damaged tissue and a compromised bladder wall left susceptible to bacteria and infection. A traumatized bladder averages 10 weeks to heal after catheter removal, and during this time, the patient can be subject to recurring urinary tract infections and potential ER visits. The innovative Duette dual balloon urinary drainage system, with both a retention and distal catheter inflating balloons, is the solution for today's patient-centric healthcare mandates. The retention balloon secures the catheter within the bladder as usual, but the Duette provides a second inflatable balloon which covers and subsumes the tip. The bladder lining is protected from the tip, and the drainage eye is kept free from aspiration and retention. Training and use are simple. Insertion guidelines are the same as the single balloon Foley with one extra step, which is inflation of the bladder protection balloon. This improved technology presents a more holistic, patient-centric approach to catheterization in which bladder mucosa integrity is maintained with active drainage. Minimizing trauma has an impact on the reduction of infections, bladder spasms, catheter blockage, and other adverse events. Conclusion: the Centers for Disease Control 12-step program to prevent antimicrobial resistance recommends preventing infection by preventing conditions that lead to infection. It is our mission at Poiesis to offer a healthier approach to catheterization, subsequently improving patient outcomes. When catheterization is necessary, request the Duette urinary drainage system by Poiesis Medical. Better patient care by design.